I've been writing about nursing for about 22 years, and one of the first things I observed when I went into the hospital was the difficult and vexing state of nurse-physician relationships. And I wrote about the history of those relationships and the contemporary aspects of those relationships in my book. But I really wanted to try to give nurses and doctors a tool that could be used to improve those relationships and to improve teamwork between nurses and doctors in order to produce better patient care.
Well, I was performing a one-woman show that I'd created called Nurse, about a nursing strike based on oral history interviews I had done with nurses in New York. And I got a note backstage after a performance from Suzanne Gordon, and I was very excited because Suzanne Gordon was one of my resources in writing the play.
All the research studies clearly show that patients die or are harmed when doctor-nurse communication is poor and when doctors don't have the leadership skills to function on teams or to establish teams or to lead teams. And so one of the purposes of this play is to kickstart the discussion among physicians and medical students and to raise issues about how they function on teams and how they might better function to protect their patients. And so one of the things we're doing is developing a workbook that explains how the play can be used, that gives a guide to holding a panel or to doing a little bit of a discussion after the play, and even presents some ideas for readings if people are interested in looking further into this problem of teamwork and why teamwork is so important in healthcare. When folks who participate as an audience actually come up with skits in a very short amount of time, they can be both very funny and very moving, and they can really involve people together. We've also had a lot of brainstorming with a group about difficult situations, and people have left having some pretty good ideas about how they could handle things in the future.
When you have a nurse get up and perform her story, even though she's not an actress, it's that sense of empowerment to get up and do it, have people recognize this is what I'm going through, and then to have the chance to actually replay a scene using the strategies. The person gets the physical and emotional experience of what it could be like, which is so much more effective than just sitting and talking about it or reading about it. Because until you actually have the chance to be in action, to talk to a doctor in another way, or to talk to a nurse in a different way, you're not going to make that leap, that transformative leap.